The question about what can I do to improve my endometrial lining, or what can I do to improve the lining of my uterus to help me get pregnant, is one that often gets asked. In this video, we're going to learn about the 7 natural ways to improve your uterine lining. If you're excited about this, then make sure to like this video. Please also leave a comment and subscribe to get the best fertility tips so you can get pregnant as fast as possible. If you're watching this video, you might be suffering from recurrent pregnancy loss, or you might have been told that your uterine lining might be the reason why you're not getting pregnant, and you're looking for ways to improve it, which obviously is the right thing to do if that's what you've been told. Well, I want to tell you that you're in the right place. I've helped thousands of women improve their fertility and get pregnant during the last 20 years of being a fertility expert. I've helped them by finding out what's not letting them get pregnant, develop a personalized fertility plan for them, and giving them ongoing support while following the plan and improving their health and fertility. So let's get into it so you can learn more about how to improve your endometrium. Okay, so before I jump into what you can start to do, my 7 tips of what you can do to improve your endometrium and your lining, we need to talk about the reasons why this is important and why something might happen that might impact your endometrium. So I've actually done a different video on this previously that really dives much deeper into this. If you want to check that out, you can check it out. I'll leave you the link in the description below. But I want to just highlight a few things right now before we dive into the 7 topics that I want to cover for all of you. So we often talk about egg quality and hopefully sperm health and all these other things, but we don't often talk about the health of your uterus and the lining or the endometrium. And it's imperative that we do because this actually helps facilitate implantation and is a very crucial part of the whole conception piece and being able to hold a pregnancy. So some things that might happen or might occur that might compromise your lining are going to be that your lining is just too thin. It just doesn't get thick enough. That might happen for various reasons. Maybe there's endometriosis, maybe there's other growths that impact it like a fibroid, maybe there's a polyp that impacts your lining, maybe you've had recurrent pregnancy loss and you've had multiple D&Cs, and so your lining just doesn't get thick enough as a result of that, which could be Asherman syndrome. So there are many reasons. Other things that may arise is that there might be a virus or an infection. The microbiome in the endometrium or in the uterus might not be ideal to allow for implantation. So there's a lot for us to look at, especially if you've had implantation failure. For the sake of this video, I want to talk about the things that you can do at home naturally that are going to improve your lining, hopefully make it nice and thick, trilaminar and receptive so that you can hold a healthy pregnancy to full term. Okay, so the first point I'm going to talk about, or the first tip that you can do, this one not so much that you can do at home, is acupuncture. Now, some of you maybe think that you can do it at home and we can use some acupressure, which is definitely great and the next best thing. But ideally, you should be seeing a trained acupuncturist and hopefully one that specializes in reproductive medicine and fertility. And I want you all to be a little judicious about this. Just because their pamphlet or their website says it doesn't necessarily mean they are actually specialists in fertility, acupuncture, and fertility Chinese medicine. They should be trained and certified. And the only organization that I know of that certifies acupuncturists and Chinese medicine doctors who are trained and have a minimum competency in reproductive health and fertility is an organization called ABORM. You can check out more information on them and their certified providers, which I am one of, at aborm.org, and we'll leave that link in the description below. But now back to acupuncture. So one of the most important things and best things about acupuncture is that it actually increases blood circulation. And if we guide it to the right area and use the right protocols, then we can actually help to increase blood going to the pelvic area, going to the uterus, and in turn thickening the endometrium. We often help support this leading up to an IVF cycle, but we can do this at any time of your, trying to conceive journey, regardless if you're trying with IUI, IVF, or naturally, it doesn't matter. So acupuncture is really, really effective for this, but again, it's not something you're gonna do at home, but I do encourage you to go seek this out and start to make it a regular pattern of something that you're going to incorporate into your fertility journey and process. Number two, which is one that I also love, I actually love all of these, but number two is vaginal steam or V-steam or yoni steam, however you decide to look it up and find it. This is absolutely something that you can do in the comfort of your own home and something that can be really, really helpful, nourishing, and relaxing as well. So this is where you're going to take a set of herbs that have been customized, hopefully for you, or something that you find that suits your needs. Now, for those members in my program, we do give them resources for all of this, but you're going to get some herbs and you're going to boil some water and you're going to put those herbs in a bowl. You're going to pour the water over it. You're going to undress from the waist down, and then you're going to sit down on a seat, hopefully that has a hole in it, and they do make vaginal steam seats just like this. And then you're going to cover yourself with a towel that goes around your waist all the way around and goes all the way to the floor, so the steam just goes up to the one area that we want. This is like getting a facial, right? You're trying to bring more moisture, more nourishment to the area, and with the right herbs, it can help nourish the lining. Other things that it can do is help clean it out. If there's a virus or an infection, it can help with that as well. So those would be different herbs, different blends. And if you find someone in your city that does this, they should be trained and have the right knowledge to be able to customize that and alter it as you need. So I do recommend doing this. Now, I did just say if you find someone in your area, it is something you can do at home, but you can also go see someone for this. You're not going to do this, and this is something I want to just highlight, you're not going to do this all cycle long if you are trying to conceive, but you can do it once a week if you're going to take some time off from actually actively trying. So just be mindful of that. If not, typically I just say that you're going to do this about once a cycle, which would be at the beginning of your cycle right after you finish bleeding. And I give you tools and videos and resources in my program, if you're a member of my program or if you become a member of my program, where you can have the resources to do this all at home on your own. Number three is one that I have not discussed, I don't think very much actually here on Fertility TV, but it is low-level light therapy. You might see it as LLLT, or you might see it as far infrared light therapy. But light therapy has been shown recently to help with this. Now, often I have discussed it, maybe with those couples that I support, about supporting egg quality, and it can do that. It's kind of be seen as a very non-invasive, simple ovarian rejuvenation support as well. But in this case, I'm talking about it to support your endometrium and your lining, so it can be used in that instance as well. There are not many units that you can actually use that I know of. They do need to sit on your skin because the light needs to be able to penetrate deep enough to reach the uterus and the ovaries or however you're using it. So there's not a ton of units that can do that, but it can improve blood circulation to the endometrium, increase blood circulation, and increase the lining and health of the lining as well to make it more receptive. Again, one of the things it can also do is help reduce inflammation. So if you have endometriosis, if you have pain, it can be helpful for that as well, which also would help with implantation. It's something that's easy to incorporate, non-invasive. You can do it at home if you get yourself a unit and you just turn it on, use it multiple times a week, 2 to 3 times a week, and you just relax while it's going on. It takes about 30 minutes. Really simple, straightforward, but really a nice addition to your regimen at home, and something, again, that's simple and easy to incorporate. I did a video a few weeks ago, if I recall, on CASTOR packs, and that's why I'm going to talk about it here as well. I mentioned it during that video, but I'm going to reiterate it here, that the fourth tip is using a CASTOR pack. That CASTOR can help, again, increase blood circulation to the area, help to reduce inflammation in the area, and so it's really nice, especially if you've got blockages or obstructions, fibroids, cysts, polyps, whatever, endometriosis, whatever that might be. It is very helpful for that. So incorporating CASTOR packs in this situation would also be helpful. Again, it's something you're probably going to do only in the beginning of your cycle if you're trying to conceive. If you're not actively trying, you can do it all cycle long, but you're going to do it maybe 2 or 3 times a week. And so one of the things that I'm sure all of you listening can hear you all saying, well, how do I do all of these things all the time? Well, hopefully, if you're doing acupuncture, you're just going to work that in once a week, maybe twice a week. The vaginal steam should only happen once a cycle, maybe a little bit more if you're not trying. The light therapy you're going to work in. And so you just have to come into a schedule where you're figuring that out. I don't like to ask anyone to do more than one thing on any given day. So maybe you alternate days where you're doing light therapy, CASTOR pack, or light therapy and a steam, or whatever that might be. So we've got to work all those things in as what's appropriate for you. And you might not do or incorporate all these things. You might say, well, I'm comfortable with this one and that one, so that's what I'm going to do. You have to decide for yourself. But number 4 is CASTOR packs. Again, I've done a whole video on this, so I'm not going to spend a lot of time on it here, but you can check out that video if you'd like afterwards, if you want more detailed information on that. Number 5, abdominal massage. Now, many of you may have heard this as femoral massage, uterine massage, Maya abdominal massage. Whatever phrase or term you want to use for it doesn't make a difference for me. The biggest thing is that your uterus is being massaged and getting the proper care and attention that it needs. And we're doing that, again, to move blood through the pelvic area, to bring more blood into the pelvic area, to help you bleed better, to bring more nourishment into the area. And so you can do this for yourself. Again, I have a whole video protocol that I incorporate in my Hope coaching program, and those members get those videos. But if you're doing it at home, at the very least, you can just massage very gently in a circle on your abdomen, right? You can also bring up on your abdomen from your pelvic area up. Those are just some simple things. In reality, I think it's best if you actually go see someone who's trained for this, who can do this once or twice a month. You can relax and let go and let them do their thing, and you don't have to try to do it and not know what you're doing. Now, maybe after you've gone to them for a little bit, they give you some exercises to do at home so you can incorporate a little bit at home as well. But ideally, it's best to see someone who is trained for this, and so I typically recommend seeing someone who's trained in Maya abdominal massage who can perform this. But check that out for yourself and see if it makes sense for you and if it's something that you want to incorporate. The last 2 things are a little bit easier to incorporate because, they're not things that you have to do in terms of self-care protocols. They're things that you might take to improve your lining. So some things that we can do for that is, number 1, this one supplement called L-ARGININE. That is a nice one that helps to increase blood circulation to the periphery, and our uterus, or your uterus, is a peripheral organ, and so it can help bring more circulation to the uterus. And this is something that we do like to incorporate if linings have a hard time getting thick enough leading up to an IUI or IVF, and that's something that you can incorporate. You do need to be careful with it. If you have an active virus, it can cause a little flare-up, so that's something to be mindful of. So you might decide that you don't want to do that. An alternative to incorporating L-ARGININE, if it doesn't fit for you or work for you, would be utilizing some Chinese herbs. Again, you will need to work with someone who is trained in Chinese herbs. I love incorporating Chinese herbs and think they do a wonderful job here if you have the right formula for somebody. But again, you need to see someone who's trained, and I did give you that resource in the beginning when we talked about acupuncture as well. So that would be number 6. And number 7 is evening primrose oil. That is another supplement that you can take that does help bring more nourishment and nutrients. It's an essential fatty acid and something that I do like to incorporate as well. Again, only if we need to. So those are the 7. If you separate L-ARGININE and Chinese herbs, then that makes it 8 recommendations on things that you can do and incorporate at home for the most part, because you can't do acupuncture at home, but things that you can incorporate into your regimen and protocol if you're trying to increase and nourish and support your endometrium and increase and thicken your lining for implantation. Which one of these tips did you like, or were there multiple tips that you liked? I want to hear from you, so comment below and let me know. And I also want to know, of the 7 or 8, depending on how you're counting, tips that I gave, which one will you possibly incorporate into your regimen if this is something that you need? Which one is more interesting to you, or you think that you can actually incorporate and be successful incorporating it? Additionally, if you have any questions around your fertility, I want to hear from you as well. So comment below and let me know, and I'll do the best I can to answer those questions for you. There are many other pieces of potentially your fertility puzzle that you might need to look at to get, additional answers and get better support on your fertility journey. If you want to really go deep into your fertility, find the root cause that's not allowing you to get pregnant, then be sure to fill out the application using the link below so that you can speak to a real person on my team, so that we can identify if we are a good fit for you, if my program can support you, and what the right next step is for you. Again, all you have to do is use the link in the description below. And now make sure to check out this other video on the 5 AMH killers that you need to stop and how that can improve your egg reserve. If you haven't already checked out that video, you can do so now by clicking on that link. All right, everyone, until the next video, stay fertile.